The digestive problems are the essential part and the core part of gut and psychology syndrome. And when we look at the digestive system, we have to understand what lives in there and what takes care of it. We have to look at the gut flora of the patient. Gut flora is a mixture of bacteria which live inside the digestive tract of children and adults. An average adult can carry between 2 to 3 kilograms of microbes in there. It's a highly organized microbial world, and in a healthy situation it has to be dominated by certain species of microbes which are called beneficial species. What happens in gut and psychology syndrome, these children and adults develop very abnormal mixture of microbes in their digestive tract, very abnormal gut flora, which first of all causes various digestive problems. It causes inflammation and various other problems inside the digestive tract, which bring all the symptoms of abdominal pain and bloating and flatulence, abnormalities in the stool, burping and reflux, and many other symptoms in these patients. At the same time, they interfere in appropriate digestion and absorption of foods. So children do not digest their food properly and do not absorb it properly, developing multiple nutritional deficiencies. And thirdly, this mass of microbes consumes the food that comes along and converts it into a whole host of various toxic substances. There are hundreds and hundreds of toxins that are produced by these microbes, and most of them absorb through the damaged gut lining in these patients, get into the bloodstream, get distributed around the body, and get into the brain. And when we talk about the most extreme case of learning disabilities in children, such as autism, what happens in these children that when their brain gets clogged with toxicity like that, and that usually happens in the second year of life of the child, because majority of women breastfeed nowadays, and breastfeeding usually goes on for a year. And while the child is breastfed, there is some protection for the child against that flora that the child has developed. But when the breastfeeding stops, that's when the protection stops as well. And that follows with an explosion of growth of various pathogenic species of bacteria, viruses, fungi, and parasites in the digestive tract. They start producing all their toxins. Toxins get into the bloodstream, into the brain of the child, clog it with toxicity, and does not allow the brain to develop appropriately. Second year of life is a very important time for developing communicational skills, appropriate instinctive behavior, appropriate toy play, and appropriate social skills in the child. The way the children develop it, we all have sensory organs, our eyes, our ears, our tactile sensitivity, our taste buds, and other sensory organs. They collect information from the environment. But then all that information has to be passed into the brain to be processed properly, and from that information the brain learns how to speak, how to understand language, the social skills, and all other skills that the child learns. But if the brain is clogged with toxicity coming out of the digestive system, all this sensory information gets into a noise, into a jumble in the child's head, from which the child cannot learn and cannot acquire appropriate skills. That's how autism develops. When the situation is milder, when the toxicity level is lower, or the toxins are not as dangerous, there may be single symptoms in the child, such as hyperactivity, or dyslexia, or dyspraxia, or some other symptoms, not as drastic as in autism. But autism would encompass all those symptoms. When these children grow up, the condition doesn't go away unless it is appropriately treated. So these children, when they're grown up, they are more prone to substance abuse, and this is the group of patients who usually react inappropriately to cannabis and other recreational drugs. In Britain, a few years ago, the government made the mistake of making cannabis more available to the population because they graded it as a less dangerous substance. So many more teenagers started using it at their parties. And what we have now is a flood of newly diagnosed cases of schizophrenia after first exposure to cannabis in our teenagers. The children who react to cannabis in such a way are GAPS children, gut and psychology syndrome children, because they're already vulnerable, they already have a vulnerability in their body. And they're also more prone to substance abuse because of psychological reasons, because during their childhood, due to poor social skills, poor learning ability, their self-esteem got quite a battering. So they are prepared to do anything to fit in, to be invited to parties, to be invited to have friends, to be popular. So they are more likely to try dangerous substances to be popular. Then we follow into endogenous depression. These patients are very prone to it, to obsessive-compulsive disorders, to bipolar disorder, and to psychosis, to schizophrenia. So the condition doesn't go away as the patient grows up, as they become adults. And when I examine a schizophrenic adult or an adult with endogenous depression or any other so-called psychiatric condition, and when I ask questions from the parents and from the patient all the way to the first day of their life, through the childhood, through the infancy, through the whole life, we find that these are gut and psychology syndrome patients, and they went through all the typical physical and mental manifestations of this disorder.